Assalamu alaikum and welcome to the second match of Cardiometabolic Premier League, the Battle of Brains, presented by PSIM and PHL, powered by Wilson's Pharmaceutical. In this Battle of Brains, there are 36 teams competing, and every match is a crucial match because every match is a knockdown match. And today's match is between Nishtar Orions versus 𝐏𝐚𝐤𝐬𝐬. Invincibles. Today we are blessed with the kind presence of Professor 𝐠𝐚𝐤𝐻𝐸𝐬𝐻 Saab. He is Professor of Cardiology at KIHD Karachi. Along with him we have with us Professor Feroz Memon Saab. He is Professor of Cardiology, VC, University of Modern Sciences, Chandu Mohammad Khan. Along with him we have with us Professor Tariq Wasim Saab. He is Professor of Medicine, Salif Memorial Hospital, Lahore, and also Senior Vice President of PSIM. Along with him from umpires panel we have Professor 𝐒𝐻𝐿𝐴𝐻𝐸 Saab. He is Professor of Medicine and Senior Vice President of PSIM. Shortly we will be joining with Professor 𝐠𝐻𝐿𝐴𝐻𝐸 Saab. He is currently serving as a patron in chief of Cardiometabolic Premier League. And last but not the least, moderator of today's session, Dr. Hamza Azhar Ghori Saab. He is Assistant Professor of Cardiology and Consultant Interventional Cardiologist and Stroke Interventionist. For further moderation, over to Dr. Hamza Ghori Saab.
So thank you very much, Usman. We are back again. So we already know that Cardiometabolic Premier League, the first season has started. We had the first match and it was a great one. So this Cardiometabolic Premier League is brought to you by Wilson's Pharmaceutical, and it has been put together by Pakistan Society of Internal Medicine, along with that Pakistan Hypertension League. And we are all geared up for the second match today. So it's going to be an interesting match. The North versus the South. We have Abbasi Institute of Medical Sciences, 𝐏𝐚𝐤𝐬𝐬, Invincibles from the North versus Nishtar Orions from the South. So let's see how it goes. Along with that, I think we have an extremely star-studded panel today. Panel of experts and our council members. So we have the Patron-in-Chief, Professor 𝐿𝐴𝐻𝐸𝐻 Saab. Welcome, sir. We'll be joined shortly by Professor 𝐿𝐴𝐻𝐸𝐻 Saab. We look forward to that. He's been instrumental in putting up the league. We have the governing council with us that is composed of Professor Feroz Memon, Professor Kashif Ali Hashmi, Professor Tariq Wasim, and Professor Muhammad Umar. They will be joining us soon. I think some of them are already there. Our two umpires are going to be extremely crucial. I think we do have one of them, that is Professor 𝐴𝐻𝐸𝐻 Saab. It was a wonderful game that we had previously. Welcome, sir. And we may have Professor Munir Azhar joining us as well. It's always good to see the mentors there, and we have mentors from both the sides. Professor Zahra Nazish, I think she's going to be there from the south supporting Multan. So we look forward to having her in the show along with the rest of the panel. So it's going to be an interesting game. The weather seems pretty good. The sun is out. And we are expecting a pretty high scoring game. We always do, but today I'm hoping that it's going to cross the 30s, getting into 40s. So we do have the two teams with us, and I'm going to randomly ask one of the two teams to start with the introductions, the captain to give the introduction of the whole team. And we have Nishtar Orions. Can we have them on the screen, please? Welcome. Introductions, please.
Bismillahirrahmanirrahim. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧. My name is Dr. Hafiz Wasif Ahmed. To my left, there is sitting Dr. Irha Saeed. To my right, Dr. Wasim Iqbal. And to my far right, Dr. Badr Iqbal. Thank you.
Welcome to the show and best of luck to you. Now we have the second team. Can we have 𝐏𝐚𝐤𝐬𝐬 Invincibles from the North?
Bismillahirrahmanirrahim. Thank you very much, sir. Myself, team captain Dr. Nabil from Medicine Department of Abbas Institute of Medical Sciences. On my right side, Dr. Zainab Shahab. On left side, Dr. Sagar Salim, on extreme left, Dr. Sajid Ali Kosi.
Well, it's great to have you on the show. Best of luck to you, in fact, to both the teams. And we are hoping for a good game today. All right. We are now moving towards the all-important toss. It's going to be an electronically done toss. So can we have it on the screen, please? So I'll ask one of the teams randomly to either pick heads or tails. So I'm going to ask 𝐴𝐚𝐬𝐻 Invincibles, heads or tails?
Tail, sir. Tail.
Okay, so they have chosen tails. Roll it, please. And it's tails. Well done. The luck is on your side, it seems. So I'm going to put two questions before you. The first one is, do you want to throw the questions or you want to take the questions?
Throw the question.
They want to throw the questions. All right. Now with the second part, the second question, you will have two scenarios, two veneers in front of you. Case A or case B. Which one do you want to choose?
Case B.
Case B. All right. So they have chosen case B. And the news from the center is 𝐴𝐚𝐬𝐻 Invincibles have won the toss. And they want to throw the questions. And they have chosen case B. Best of luck to both the sides. All right, do I have the permission from the council to start the game? All right.
Yes,
All
please
right,
go
sir.
ahead.
Thank you very much, sir. With this, we are now going to start with the first innings. Can we have the scenario, case B, on the screen, please? And 𝐴𝐚𝐬𝐻 Invincibles, you can read the scenario, please.
A 40-year-old male came to the emergency with shortness of breath on minimal exertion. He denied any cough, sputum production, chest pain, or palpitations. There is a history of loud snoring, daytime somnolence. On examination, he is obese with a BMI of 35. He has type 2 diabetes and hypertension. There is no history of cigarette smoking or any allergy.
All right, so Nishtar Orions, I'm going to give you a couple of seconds to gather yourself, and then we'll start with the first question. Are you ready?
Yes, sir, we are ready.
Okay, they are ready. Can we have question number 1 on the screen, please? Read it. Invincibles, read it, please.
Probable diagnosis: COPD, chronic obstructive pulmonary disease, asthma, obstructive sleep apnea, pneumonia, and hypersensitivity pneumonitis.
हमजा आवाज नहीं आ रही.
And your okay, and your timer starts now. 60 seconds. I think there is some voice issue. We are unable to hear them loudly. So just hold it for a second here. Please hold the timer. Hold the timer. Okay. So Nishtar Orions, can you hear them properly? Were you able to hear them?
No, sir, we cannot hear them.
Okay, so I think I'm going to ask the Invincibles again to go through the question because nobody was able to hear it clearly. I could hear them, but it wasn't clear. I think we need to increase the volume or maybe change the mic. Can I have...
I think the volume is very low. It's a very low volume.
Yes, I agree, sir. The volume is low. Technical team, can we put it right? So we'll have to go through question number 1 again. So I'd like Invincibles to speak to me. 𝐴𝐚𝐬𝐻 Invincibles, can you hear me?
Yes, sir. We can hear you. Sir, just a second, sir.
Okay.
Kindly इसको ये remove कर देना ताकि हम question पढ़ सकें.
Technical time, please assist them, help them out.
डॉक्टर हमजा, लास्ट वीक भी प्रॉब्लम से उससे पहले लीग में हमारे बिल्कुल स्मूथली जाता रहा सब कुछ. I don't know what happened to audiovisual. We are having constant problems, you see, and it's costing.
Yes, sir, you're very right. This was a concern
And it
that was
makes
shared with them.
a very unpleasant start for the teams also.
Yes, I totally agree.
एम्स अगर आप माइक
मुझे नहीं पता
माइक
कि प्रॉब्लम कहाँ है मेरे में
अभी
से
आवाज आ रही है?
एम्स अगर आप माइक को क्लोज कर लें और थोड़ा सा लाउड बोलें, क्योंकि आपकी आवाज आप बोल बहुत आस्ता रहे हैं, मैंने चेक की है सेटिंग, प्लीज।
अच्छा, अभी आवाज सही आ रही है?
जी जी, थोड़ा सा तेज बोलें और माइक क्लोज कर लें।
अभी ठीक है आवाज? काइंडली ये चेक कर लें।
अब ठीक है, we can hear them now.
Okay, so that's good. I think that was the issue. So you have to speak a bit louder, keep the mic close to you. And I think in this way it's going to be easier for everyone. So you can go through the question number 1 again, please.
So question number 1 is, what is the probable diagnosis? Chronic obstructive pulmonary disease, asthma, obstructive sleep apnea. Option D is pneumonia and option E is hypersensitivity pneumonitis.
And the timer starts now, 60 seconds. Well done. That's more like it. We could hear you well.
We would like to answer.
Oh, you want to answer?
Yes, sir.
That means you're coming down the wicket trying to hit it over long on. Yes?
That's
Ishaq
the
Saab won't
plan.
be happy.
Yes,
One thing for sure. What's the answer then?
We are going with option C, obstructive sleep apnea.
Are you sure about it? You want me to lock it?
Yes, sir. We are sure.
Okay. They are really sure. Lock C. Obstructive sleep apnea. C Charlie. Lock it. And yes, that's a brilliant start. We start off with a 6. Very well done. Yes, that's the kind of start we needed. So well done. And I'm hoping that you'll keep up with it. Good, good.
Well done, and please keep the mic as close as possible to your mouth.
Ishaq Saab is very right on that account. Keep your mics close to your lips. We want to hear you clearly. All right. Question number 2 on your screen.
So question number 2 is, what is the diagnostic test for obstructive sleep apnea? Option A is spirometry, B is arterial blood gases, C is overnight polysomnography, D is HRCT, and E is lungs biopsy.
Your 60 seconds are on your screen. And I'll request the answering team to keep the mic open so that we can hear the discussion.
Have they locked? We would like to answer.
Again, he's come down the wicket. This time he's trying to hit it over covers. What's the answer?
Option Charlie, overnight polysomnography.
C Charlie. Okay, you want me to lock it? Should I?
Yes, sir. Lock it.
Okay, lock C Charlie. Yes! That was a full toss, and I think we could all see this one going over the ropes for a 6. Well done. So 2 6s and 2 deliveries. Good. All right. Question number 3 on your screen. Read it,
Question number
please.
3 is, in a clinical setting, which of the following would be best parameters to assess obesity? Option A is BMI. Option B is waist circumference. C is observation and clinical judgment.
बेटे माइक को हाथ पे पकड़ लो, अपने करीब ले आओ.
सर अभी आवाज ठीक है?
Much better, much better.
Sir. Sir, question number 3 is, in a clinical setting, which of the following would be best parameters to assess obesity? Option A is BMI.
I'll ask the teams to start once they have read the question. No discussion, please. Please wait for the question.
Option C is observation and clinical judgment. Option D is plasma top 10 concentrations, and option E is a composite of BMI and clinical evaluation.
All right, timer starts now. Now you can start the discussion. Thank you.
This time it is the BMI healing.
नहीं आजकल मेरी बात सुनो, बीएमआई है लेकिन मेटाबॉलिक सिंड्रोम में ओबेसिटी वेस्ट सर्कमफ्रेंस से देखते हैं, तो ये ज्यादा बेहतर है. तो इसमें वेस्ट सर्कमफ्रेंस भी आ जाएगा, बीएमआई भी आ जाएगी, क्लिनिकल इवैल्यूएशन भी आ जाएगी. तो आई थिंक वी शुड गो विद ई. श्योर?
E is the best.
ऑब्जर्वेशन क्लिनिकल जजमेंट नहीं है, प्लाज्मा. ठीक है. Sir, we would like to go with option E. A composite of BMI and clinical evaluation is the best way to assess obesity.
Okay, so E epsilon. You are sure you want me to lock it?
Yes, sir.
Okay. Lock E epsilon. Oh yes, that's a hat trick. Well done, Multan. That's great. 3 in a row. Let's see how far we're going to go without losing any of the questions. I hope you score all of them right. In fact, both the teams. That will lead us into a knockout stage. So that's what we are hoping for. Very well played. Well done. Now, question number 4 is on your screen.
Diagnosed with OSA, obstructive sleep apnea, he was advised weight loss. How much minimum weight loss is required for clinically relevant improvement in risk parameters such as diabetes and OSA, etc.? Option A is 10 to 15%. Option B is 5 to 10%. Option C is 12 to 15%. Option D is 10 to 12%. And option E is 15 to 20%.
60 seconds on your screen.
अच्छा, इसमें ना मैं बताऊं, अभी रिसेंटली मैंने पढ़ा है कि अगर प्री डायबिटीज हो ना तो उसमें या डायबिटिक हो, आप कहते हो कि 5% लूज करो बॉडी वेट, तो उससे 50% इंप्रूवमेंट हो जाती है ग्लाइसेमिक कंट्रोल में. 5% मुझे याद है, लेकिन इन द सेटिंग ऑफ डायबिटीज में आई थिंक बी ऑप्शन जो है ना 5 to 10% ये है सही. कोई बात नहीं, लेकिन वो मुझे याद है कि मैंने डायबिटीज में पढ़ा हुआ है 5%. आई थिंक वी शुड गो विद दिस.
ठीक है. 5 to 10.
This one is an in swinger. It's coming in. Let's see whether they hit it for a 6.
So we would like to go with option beta, 5 to 10% weight loss.
Option beta, 5 to 10%. Are you sure about it? You want me to lock?
Yeah, 50-50. I think we are sure. We are going to go with this.
Let's see what happens when they are 50-50. Lock B beta. And yes, when you're 50-50, even then you've hit it for a 6. Very well done. Very well played. I really enjoyed this one because it was the camaraderie, the discussion that was going on, and I think very well played. The captain leading from the front. Well done to the whole team.
हमजा साहब, डॉक्टर फिरोज बात कर रहा हूँ.
Sir.
Thank you very much again. A very interesting and very knowledgeable program. लेकिन मेरा ख्याल है कि हमने लास्ट टाइम ये डिसाइड किया था कि स्टैटिस्टिक्स में परसेंटेजेस नहीं डालेंगे बिकॉज दिस इज वेरी कंफ्यूजिंग. तो 10% 20% होता है, तो इस तरह का सवाल शामिल नहीं करेंगे. अब इन तरह चूंकि जवाब दुरुस्त आ गया तो इट्स वेरी गुड, बट आई थिंक वी शुड बी केयरफुल रिगार्डिंग दिस थिंग.
Very right, sir. I think this point has been discussed many times. I think in this league as well as in the previous cardiac league. So I think I'll direct it towards the council. Yes, sir. Sure, sir. Please.
I think in this situation, percentage is important because losing 5 kg from 50 has got different meaning than losing 5 kg from 100. So it has to be percentage in this case.
Very right, sir. It's a valid point. I think this is for the council to decide because we do need, at times we will come across these percentages and at times we do need to know them. So I think the council can guide us further as well, and that's why we have our faculty. So thank you very much for the input, sir.
I agree with Professor Azizur Rahman because यहाँ there's a massive major difference in percentage, but कभी-कभी बहुत कम होता है, 2 to 5, 5 to 7, तो वो नहीं होना चाहिए. This is what I was suggesting.
Very right, sir. बिल्कुल दुरुस्त है. I think you've got an extremely valid point, and
thank you.
This will be taken care of, hopefully, inshallah, by the reviewers, and they'll ensure that. So great, very well done.
Hamza keeps everybody happy.
Sir, I try to at least.
You're a diplomat, my friend. Well done.
Thank you very much, sir. I try my best. I think no matter what, the show must go on, and we all have to do the best that we can. So with this, back to the game.
Go ahead.
Can we have the next question on the screen, please? Question number 5. Read it, please.
Patient was also interested in starting some medication for weight loss. Out of the following, what is the most suitable option for him? Option A is orlistat, option B is phentermine, and option C is naltrexone, option D is liraglutide, and option E is bupropion.
60 seconds on your screen. Start the timer, please.
हाँ ठीक है. I think ये डी है. डायबिटीज भी हाँ नहीं, उसकी वजह यह है कि देखो डायबिटिक भी है और उसका बीएमआई जो है ना वो 35 है, एंड 35 इज एन इंडिकेशन फॉर गोइंग फॉर दिस GLP-1 के लिए। तो लीराग्लुटाइड एक्जिनाटाइड फैमिली से ताल्लुक रखता है, तो आई थिंक ऑप्शन डी इज द बेटर ऑप्शन। सो उसको डायबिटीज भी बेहतर होगी और वो भी ठीक होगा। तो
वेट भी ये है भी इंडिकेशन।
sir, we would like to go with option delta liraglutide.
Okay, so you want me to lock D delta liraglutide? Sure?
Yes, sir. Yes, sir, sure.
Okay, they are sure. Lock D delta. Oh goodness, that's another one. Wow, 5 in a row. Very well done. What a game.
What the hell is going on, Hamza? What the hell is going on?
Sir, Multan has
My
come
goodness.
prepared. I think Nishtar is doing a wonderful job. But I think 𝐏𝐴𝐚𝐬𝐻,
And
they may just...
Still of the century.
I must compliment their body language and their discussion and their confidence.
And their
Very
confidence,
right.
Indeed.
Very right.
Indeed.
Thank you, sir.
And-
Thank you
and
for
the-
the appreciation.
And the luck as well. Good.
I'm not
Yes,
sure about
I
that.
think it's the discussion that is actually going on. And I'm sure 𝐏𝐴𝐚𝐬𝐻 should not be under pressure. Invincibles, you can come out all guns blazing as well. And we are hoping for that. Nothing is lost yet. There are still 5 more questions to go in this innings only. All right. Can we have question number 6 on the screen?
Question number 6. What is the major side effect of orlistat? Option A is abdominal cramps. Option B is dyspepsia. Option C is fecal urgency. Option D is vomiting. And option E is constipation.
60 seconds starting on the screen.
अच्छा, इसके अंदर ना फीकल अर्जेंसी और फीकल इनकॉन्टिनेंस, ये मैंने पढ़ा हुआ है इसके बारे में, मुझे याद पड़ रहा है। ये और लिस्ट में फीकल अर्जेंसी भी होती है और फीकल इनकॉन्टिनेंस भी हो सकता है। कॉन्स्टिपेशन नहीं है, वॉमिटिंग नहीं है, नहीं डिस्पेप्सिया भी नहीं होता। क्रैप्स वर्सेस फीकल अर्जेंसी है, मुझे सही लग रहा है। फीकल अर्जेंसी का वर्ड मैंने ऑर्ली स्टैट के टॉपिक में पढ़ा है, ये मुझे कंफर्म है, ठीक है, क्योंकि उस टॉपिक में मैंने अर्जेंसी का वर्ड पढ़ा हुआ है।
20 seconds.
We would like to go with option Charlie. Fecal urgency is a side effect of orlistat.
Okay, you want us to lock C Charlie. Let's see whether this one is a googly or not and how they've played it. Lock C Charlie. Oh yes! It's a paddle sweep for a 6. Goodness, over the third man. What a shot, and very, very well played. I think the way you are taking it, the way you are discussing, it's brilliant. Very well done. Your mentor, your coaches, they must be very happy. Why not? Why not? All right. Moving to the next question. Question number 7.
Question number 7. How much exercise is recommended by American College of Sports Medicine for a healthy person? Option A, 50 minutes of vigorous intensity aerobic exercise activity per week, 100 minutes of vigorous intensity aerobic exercise, 100 minutes of moderate intensity aerobic exercise per week, 150 minutes of moderate intensity aerobic exercise per week, and 75 minutes of moderate intensity aerobic exercise per week.
And the timer starts now.
150 मिनट्स जो है उसके मॉडरेट था और 75 मिनट्स था इंटेंस था और एरोबिक था, ठीक है। तो स्पोर्ट्स मेडिसिन में 150 मिनट्स ऑफ मॉडरेट इंटेंसिटी एरोबिक एक्सरसाइज पर वीक डेल्टा। We would like to go with option delta, 150 minutes of moderate intensity aerobic exercises per week.
Okay, so you want me to lock delta. How sure are you?
Close to 100%.
Because you've come down the wicket and you're going to pull it for a 6. Let's see whether you get caught or not. Lock option, which one? Say it again.
D.
D delta, lock it. Oh yes! I may lose my voice today the way you guys are going because you are making me scream on every answer. Very well done. Wow, that's too good. Very well done. All right. Moving to the next question. Question number 8. Read it,
Question
please.
number 8. Patient is unable to lose weight despite diet and exercise and wants to consult for surgical options. What are the approved indications for bariatric surgery? Option A, BMI more than 35 without a significant comorbidities. Option B is BMI more than 30 with obesity related complications. Option C is any BMI when lifestyle modification fails. Option D is BMI more than 35 with at least 2 obesity related complications. And option E is obstructive sleep apnea, apnea irrespective of BMI.
The time starts now.
So BMI 35 भी हो रहा है और एटलीस्ट 2 कोमॉर्बिड्स भी उसमें हो रहे हैं, अदरवाइज हमें 40 चाहिए था अगर सर्जिकल हमने देखना है तो, ठीक है। Sir, we would like to go with option delta D, BMI more than 35 with at least 2 obesity related complications. D.
You want me to log D delta?
Yes.
Okay, so he has come down the wicket again. They are just playing it like a T10, I would say. All right, lock D delta. Oh, yes. So, another one for a 6. Very well done. And this one is straight over the bowler's head. What a stroke. I think this is brilliant stuff. The way they are tackling it at the moment, it's exemplary. Well done. Very well prepared and great discussion to go with it. Come on, Ames, Invincibles, you have to keep your spirits high. You can do it in the same manner. We are all hoping for it. Question number 9, the second last question of the innings. On the screen, please.
Question number 9. Which of the following surgical procedure is associated with greatest benefit, especially in diabetes? Option A is sleeve gastrectomy. Option B is 𝐏𝐚𝐤𝐸 gastric bypass. Option C is adjustable gastric banding devices. Option D is endoscopic sleeve gastroplasty. And option E is liposuction.
And the timer is on the screen.
Endoscopic sleeve gastroplasty.
लिपोसक्शन करने नहीं है, दो एनवाई करनी है, स्लीव गैस्ट्रेक्टमी है या एंडोस्कोपिक स्लीव
गैस्ट्रेक्टमी एंडोस्कोपिक स्लीव में से रख रहा है।
हाँ, क्योंकि हम दो एनवाई कर नहीं सकते क्योंकि हमने इंसुलिन भी रिलीज करानी है ना जो इनक्रेटिन के।
25 seconds.
You sure कि round NXY नहीं है?
नहीं है क्योंकि हम इनक्रेटिन भी तो रिलीज कराने हैं।
15 seconds.
Sir, we would like to go with option delta, endoscopic sleeve gastroplasty.
How sure are you?
To be honest, not so sure as before. But
Okay.
This seems like a reasonable option.
So he is still not sure again, but he has picked, and in fact they have picked option D delta. The whole team is together in it. Lock D delta. Oh, that's the first miss. The first miss of this innings, and that also came in the 9th question. Never mind, you guys have done very well indeed. So, with this, we are now moving to the last question of the innings. Can we have question number 10 on the screen, please?
Why gastric bypass is associated with how much total body weight loss? Option A is 25% of total body weight loss at 1 year. Option B is 30% total body weight loss at 1 year. Option C is 20% total body weight loss at 1 year. And option D is 15% total body weight loss at 1 year. And option E is 30% of the total body weight loss at 6 months.
Timer starts now.
If I have some total body weight loss at 1 year, 30%. Wrong XY.
D और E नहीं 30% है, 50% था, वो तो एक ही बात है।
फिर 20 से किसने?
120 मुझे बेस्ट लगा। आप कौन सा बताओ?
ये तो
25 seconds.
तो
30% या 20% में से कोई देख लो।
30% total body at 6 months पे?
At 1 year.
नहीं,
B और C में से देखो।
15 seconds.
Last 30% at 1 year. B.
Come on, 10 seconds now. 7.
We would like
Answer.
to go with option B, 30% total body weight loss at 1 year.
Option B, beta, right?
Yes, sir.
Okay, they want me to lock B, beta. Lock it. Oh, yes! You got this right and very well played. They were not sure. We could see that. But even then, they got it right. I think the way they've done it, it's brilliant and it is a fantastic score. They've only missed one question and they've put up a total of 54. By answering 9 questions correctly, they only missed one question, and that is a high score. That's exactly what this league needed in this second game, and that's what they've provided us. And I think it's going to be tough, but Invincibles, I think you must take it as a challenge. I think you can do it. So it's a great game. And with this, we have come to the end of the first innings, and I will request my council members, my panel members to give their comments, and I'm going to go towards Professor Aziz Rahman Saab. Sir, your comments please. He's also the umpire for the game.
I'm very, very happy the way it is conducted, and your performance is always very, very great. And this time team also did very well. I must compliment the winning. I think, I'm not sure it's winning, but they have performed very well. And I like this discussion, the loud discussion. I think this is a very important component.
Very right, sir. Thank you for the input. I think this discussion actually shows us how they think about things. And it's a testament to their hard work and their teachers who have taught them. So well done indeed. And we have now Professor Mohammad Ishaq Saab. He's always there as, as a mentor, as a guide.
Thank you. Thank you very much. What an excellent match. What a treat for all of us. I think this is the highest score I've seen so far in any tournament. And all the compliments go to their mentor and those who have prepared the team. I think they did very well. They were fully confident, and against the principle of utilizing the whole 60 seconds, they have been able to jump before that because they were very sure and they were very confident. So very well done, excellent. They have made it difficult for the other team, but I hope they'll also play well and score a good numbers. But anyhow, it's a learning process, as we always say. It's a learning process for the trainees, for the fellows, for our registrars, but at the same time for us as well. And I think this was a very sort of clinical question that we come across every day, and they have answered very well. So I wish the other team also best of luck. But naturally, the score is very high, and they have to come up with good answers to match the score that they have done so far. So excellent comments from my friend Aziz Rahman Sahib, from Firoz, from everybody. And thanks to you for making it a lively show. Otherwise, it can be very boring. So thank you very much.
Thank you very much, sir. I think your comments are extremely important. Ishaq Saab is so phenomenal. You see, even when the background is so dark, he shines like a star. So thank you very much, sir. And with this, we also have Professor Feroz Mehman. Sir, your input, please. Professor Feroz Mehman, is he there? Okay, we also have Professor Kashif Ali Hashmi, if he's there.
I think it's a very good show by Nishtar team, and probably Muzaffarabad has very little margin of error. Very good score to chase. Good luck for Muzaffarabad, and very good show by Nishtar team.
Thank you very much, sir. Your comments are going to be extremely important. We have Professor Tariq Wasim with us. Sir, your comments, please. So you'll have to unmute your mic, Professor Tariq Wasim. I think he's there. Could you unmute, sir? So
can you hear me now?
Okay, yes, we can hear you. He's there. Welcome.
Yes. So I said that the Nistarian has raised the bar quite high, and of course it would be a difficult score to match with. So best of luck to Muzaffarabad.
Thank you very much, sir. I think it's definitely the bar is high, but you never know. We have seen funny things happening in the game, and this is no less, I tell you. So we also have the mentor from Multan, Professor Zahra Nazish. Is Madam there? Can we have her on the screen? Ma'am, you'll have to unmute.
I think the Multan team owes us a box of Sohan Halwa now.
For sure. I think it's been a wonderful performance by them. So, Professor Zahra,
box would be too small. It has to be a carton.
I think it has to be sent to everyone then. All the council members and the moderator.
कोई प्रॉब्लम नहीं है.
और मेरा ख्याल है इनकी जो परफॉर्मेंस है इतनी अच्छी है वो भी सोहन हलवे की वजह से है. Because it has got a lot of almonds, so their brain, I think, neurons have been stimulated by Sohan Halwa.
Very right, sir. So I think that's it from here, and now we have to move towards the second innings. So it's going to start very soon, and I hope the teams are ready, and best of luck to Muzaffarabad, 𝐴𝐚𝐬𝐻 Invincibles. You can do it. So come on. All right. Can we have the scenario on the screen, please? I'll request Nishtar Orions to read it.
Okay, a 65-year-old male with diabetes and hypertension came to the medical OPD for uncontrolled hypertension. He was taking lisinopril 10 mg once daily. His clinic blood pressure was 160/100. Another agent was added to lisinopril. After a few weeks, he developed painful swelling of his right big toe.
Okay, so Invincibles, you can take a few seconds to gather yourself, and then we will start with the question number 1. 𝐴𝐚𝐬𝐻, are you ready? Are you? You have to speak a bit louder. 𝐴𝐚𝐬𝐻.
We are ready.
Okay, they are ready. Show us question number 1. Read it, please.
Question number 1. Which of the following drugs may be responsible for the presentation? Option A, calcium channel blocker. Option B, thiazide diuretic. Option C, loop diuretic. Option D, beta blocker. Option E, aldosterone receptor antagonist.
60 seconds on your screen, please.
Beta beta.
Okay, so you have to speak a bit louder. B, beta?
B option B.
Okay, so they've come down. They've come down the wicket. They're also going for glory. They want to heave it over long on. Let's see. B beta. Lock B beta then. Oh, yes. Well done. You can do it. Great. That's a 6, and we were all hoping for this. Good start. Well done, Invincibles. Are you Invincibles? Let's see. Question number 2 on your screen.
What is the next investigation to aid in the diagnosis? Option A, CBC. Option B, RA factor. Option C, ANA. Option D, uric acid. Option E, ESR.
Timer starts now. 60 seconds, please. And I'll request the 𝐴𝐚𝐻 Invincibles to keep their mics open. We want to hear your discussion because we can't hear you.
Delta. D delta.
D delta.
D delta.
Okay, so they want us to lock D delta. All right, I'm going to lock D delta. Oh, yes. That's a 6. Well done. A good one. I was hoping for this one because I thought this was again a full toss. And yes, you've played it well. You still have to hit it far enough to go over the boundary, as it is in any game of cricket. And this is no less. So, moving to Question number 3.
Uric acid test was done one but turned level is within normal range. Now what is the diagnosis? Option A, acute gout. Option B, septic arthritis. Option C, reactive arthritis. Option D, osteoarthritis. Option E, pseudo gout.
Timer starts now.
A alpha. A alpha. A alpha.
Okay, you want me to lock A alpha, acute gout, right? You want me to lock it? Okay,
Yes,
it was
sir.
a bouncer. They're hooking it. Let's see what happens. Lock A alpha. And yes, well done. 3 in a row. Okay. I told you they will not be any less. They can compete well.
It's a good day, Hamza. It's a good day today.
I told you it's a wonderful wicket to bat on. So both the teams are doing really well. Well done, and we are so happy to see this. All right. Question number 4 on your screen.
If the synovial fluid examination is done, which crystals are likely to be found? Option A, calcium pyrophosphate. B, basic calcium phosphate. C, monosodium urate. D, disodium urate monohydrate. And E, cholesterol.
Timer starts now. 60 seconds.
C Charlie. C Charlie.
Okay, so you want me to lock C Charlie. Are you sure about it?
Yes, sir.
Okay, they are very sure about it. Lock C Charlie. And it's a 6 again. 4 in a row. It's raining 6s today from all over. Well done. Very well played. I told you all it's gonna get tough. And here it is. All right. Well done. Question number 5 on the screen.
How will you manage acute presentation of acute gout? Option A, paracetamol 1 gram thrice daily. B, intravenous methylprednisolone 100 milligram. Option C, colchicine loading dose followed by maintenance dose till attack subsides. Option D, allopurinol 300 milligram daily for 1 week. And option E, tablet methotrexate 10 milligram once a week.
And the timer is on your screen. This may be a cross-seam delivery. Let's see what happens. How they cope up with this. We still can't hear them discussing it. Please keep your mics open. 𝐏𝐚𝐤𝐬𝐿, Invincibles. Multan is really relaxed. Okay, what is it? C Charlie. Okay, you want me to lock C Charlie. Should I lock it?
Yes, sir.
Is this a 5th 6? What do you think?
Yes, sir.
Okay, lock C Charlie. And yes, it's the 5th one. They know it. All of them, they know it. They're so sure. Great. Great preparation. And we are all so happy to see you performing so well. All right, it's getting tougher now. Question number 6 on your screen.
What is the most common side effect of colchicine limiting its use? A, hepatotoxicity. B, cardiotoxicity. C, GI toxicity. D, hypersensitivity. And E, neurotoxicity.
60 seconds on your screen. Okay, so we can't hear any discussion going on. Yes?
C Charlie.
C Charlie. Is that so? C Charlie, you want me to lock it? C Charlie?
Yes, sir.
Okay, they want me to lock C Charlie. It's an off cutter. Let's see. C Charlie. Lock it. Oh! Even that's going for a 6 over extra covers. Wow. Brilliant. So that is 6 in a row. They are matching Nishtar Orions like anything. So it's neck and neck. Are they going to drop any questions? Let's see. And I know Nishtarians, they are now getting worried. It's getting tougher. Let's see what happens. Question number 7 on your screen. Can we have question 7? Okay.
What is the target uric acid level according to the British Society of Rheumatology guidelines to prevent the subsequent attacks of gout? Option A, less than 5 milligram per deciliter. Option B, less than 4. Option C, less than 6. Option D, less than 7. Option E, less than 3 milligram per deciliter.
Timer starts now. 60 seconds. This one is in the block hole. Let's see how they tackle this. Invincibles, what's the discussion all about? We can't hear you. We are approaching 25 seconds. Come on, 20 seconds. 15 seconds. Are they there? Do we have Muzaffarabad on board?
Alpha.
Okay. Alpha. You want me to lock Alpha?
Yes, sir. Alpha.
Are you sure about it?
Yes, sir.
We
They
can't
are
hear them.
They are
We can't hear them.
Sir, there is a technical issue going on towards Muzaffarabad. They're trying to fix it. So the team is on it. So I think we'll have to carry on. It's already a great effort by the team to put it up together. So Alpha, A Alpha, lock A Alpha. And yes, they are correct. Yet again, 7 in a row. Very well done. You still have to know the answers. I mean, the way they are doing it, this shows the preparation that is there. Well done. Very well done to both the teams. Okay. Now you just have 3 questions to go. And you just can miss 1 question. It's going to be a tie then. If you miss 2, then you're out. If you answer all of them, you win it. And it's going to be a record score. So question 8. Be very careful with the questions now. Question 8 on your screen.
Which of the following is not the indication to start urate lowering therapy? Option A, tophi. Option B, acute gout. Option C, renal impairment. Option D, nephrolithiasis. Option E, chemotherapy-induced hyperuricemia.
Timer starts now. Now the Nishtarians are hoping for reverse swing. Let's see whether they're going to get it or not. Discussion going on in Muzaffarabad. But we can't hear them, unfortunately.
Beta.
Which one?
Beta.
B beta.
Beta.
Okay, acute gout, beta. Is that right?
Yes, sir.
Okay, lock B beta. And yes, that's very well played. Well done. Well done. We were keeping our fingers crossed because now we are getting to the wire. We have gotten to the last 2 questions which will make all the difference. Very well done. Well played. What a performance. Okay. Now we are moving to the second last question. Question number 9 of this innings. Can we have it on the screen, please?
What would be the best anti-hypertensive choice for patient with history of gout and blood pressure of 160 by 100? Option A, thiazide diuretic. Option B, beta blocker. Option C, ACE inhibitors. Option D, ARBs. And option E, mineralocorticoid receptor blocker.
Timer starts now. 60 seconds. So, has Multan got fingers in their mouths? Are you biting your nails? Let's see what happens. The discussion is going on and we are enjoying the visuals, the way they are, but you can't hear them, unfortunately. There is a technical problem in terms of the audio. It's already a magnificent effort by the team to put up this show over there. They were having a lot of issues. So it's less than 20 seconds now. Come on. Approaching 15 seconds.
Delta.
Are you sure about delta? D delta?
Yes, sir.
Okay, they are sure. They want me to lock D delta. Lock it, please. D delta. Oh, yes. Wow. Brilliant. So the scores are level. Wow. 54 apiece. And Muzaffarabad, 𝐴𝐚𝐬𝐿 Invincibles, they still have one more question to go. Now, if they come up with the correct answer, they'll win. If they miss that, the scores will be level. And we are going to the knockout stage, the super over. Let's see what the destiny has for us. All right, this last question, question number 10, has become extremely important. Can we have question 10 on the screen? Read it, please.
What is the mechanism of action of allopurinol? Option A, uricase inhibitor. Option B, recombinant uricase. Option C, xanthese oxidase inhibitor. Option D, hypoxanthese inhibitor. Option E, blocked tubular reabsorption of urate.
And the timer starts now. Are they going to answer it? What?
Charlie, sir. C, Charlie.
Are you sure about C, Charlie?
Yes, sir.
How sure are you?
110%.
110%? Okay. Let's see whether they are right or not. Lock C, Charlie. And yes! Well done! Brilliant! What a finish! So they've scored 10 on 10, 10 out of 10, 100% score. Whereas we all know Nishtar Orions, they had also put up a wonderful score. It was 54, just missed one question. And now Invincibles from Abbasi Institute of Medical Sciences, Muzaffarabad, they came in, all guns blazing, got all the questions right. They got them all right. That's a brilliant performance by both the teams. Congratulations to 𝐴𝐚𝐬𝐿 Invincibles. Commiserations to Nishtar Orions. I think you also did very well. But then at the end of the day, you see, we always have one team, I would say, winning. The other team is also winning, not exactly losing. But this is how it goes. So brilliant performance. And with this, I think I'm going to move towards the panel. And I think I'll straight away go towards Professor Javed Akram Saab. He has joined us. He's the patron-in-chief. Sir, your thoughts? Invincibles have done really well. Both the teams have done really well.
Yeah, thank you so much. I hope I am audible and visible.
Yes, sir, we can hear you.
Yeah, I had some technical issues with the email that Usman very kindly sent. I think my security won't allow me for the Royal College. Anyhow, it's always a pleasure to be amongst our children, sons and daughters. And this time we go to...
we can't hear them.
Okay, this time I said we are in 𝐤𝐴𝐽𝐾 versus Multan, mashallah. And wonderful scoring. I can see 54-54. It's a tie match. So it's a great initiative, and it's always a pleasure to be part of this very activity.
Right, sir. Thank you very much. It's great to have you on the show.
Hamza, I want to say something.
Please, sir, go ahead. Sir.
Although I reviewed these questions, I vetted them, but I think in the second part, the question number 9 needs to be revised.
All right, sir.
Because that, these ACE inhibitors are also, I think, losartan specifically also has a uric acid lowering effect. And this guy has got hypertension plus gout. Maybe losartan ACE inhibitor may be a better choice. Although otherwise we prefer ARBs over ACE inhibitors. But I think this question has to be taken back and they have to be given another question.
Losartan is an ARB, of course, one of the first ARBs, and it has a uric effect. And as 𝐸𝐶 said, it has a, but the only disadvantage with losartan is that it's not a 24-hour drug, but it's a wonderful ARB. It's one of the first ARBs to be tested, and I personally have done many studies on it, and I found it very good if given twice a day.
Very right, sir. I think this is extremely important input.
Sorry, let me correct myself. Yes, I thought I confused. I thought losartan is an ACE inhibitor. Sorry, losartan, since losartan is also ARB.
Yes.
So I think then the question is valid.
Yes, sir, because yes, I totally agree with you. I think it's an ARB and it's got a uric effect. It works well with, high uric acid levels. And Professor Javed Saab, I think he has mentioned correctly, it's the duration of action which can be questioned. But as the council has said, so we'll accept the question and the answer, and we know the outcome. So it was great to have all of you, and Professor Ishaq Saab is also there. Sir, can you hear me?
Thank you, Hamza. I could not hear what Professor Javed Akram and Professor Aziz Rahman has said, but it's an incredible match that we had today, one of the best ones. Congratulations to both the teams. They were neck to neck. One drop by Nishtar Orions. I think the questions, if my colleagues will agree, were relatively simple, with one or two difficult questions, but most of the questions were straightforward, and that's why we had such a good score. I think I have to just give my compliments to both the teams. There's always one or two questions which can be questioned and which can be analyzed in the light of evidence provided. But I think once the questions have been accepted by the council, we should abide by the answers that are given there, unless there is a dispute by the concerned party. So that has been the practice in the previous tournament. And yes, one or two questions do sound different from the answer that they gave, but then I think there's a lot of evidence to support them. Once again, both the teams deserve our congratulations for preparing the match properly, answering properly with confidence. And both the scenarios were typical day-to-day scenarios. And gout is something which most of our cardiologists tend to ignore. It's a disease which has a very difficult course and a lot of morbidity. And it's one of the risk factors for coronary disease as well. So I think when we are treating the patients in cardiology clinics, we should make sure that the uric acid has been checked as well. So I think with this and the medicines that we prescribe should be kept in mind whenever we see some metabolic derangement, because there are medicines in blood pressure treatment which are metabolically inert, and there are medicines which are metabolically active, and they have got effect on the electrolytes, urea, creatinine, and so on and so forth, and the urate levels. So I think these questions give us a stimulus to read more and more. And I think the purpose of the tournament भी यही है, और ये we are getting the objective done as well. So thanks to all the worthy colleagues, especially Aziz Rahman Sahib and Javed Akram. हम लोगों ने बिल्कुल शुरू से ही बैठे हुए थे. We started a bit late. And I think, Hamza, you should stress upon Wilson to make sure there's no technical problem next time. Because sometimes we lose the voice, sometimes the volume is low. That should not happen again.
Sir, you're
Thank
very
you very
right.
much once again.
Very right. Thank you very much, sir, for your extremely important input. I think this match, was extremely difficult for them, and we've already been in touch with them. I think I was told that this may not even happen. So it was a Herculean effort which led to this match coming up and being broadcast to everyone. So we now also know the internet situation that's going on. So I think in these difficult times, it's again a good effort by everyone, but we always have to improve. We've already had a successful league where we had a brilliant season. So hopefully, inshallah, I think it's going to get better and better, and the team is on it, and the technical team is also there to listen to us. So very rightly said, sir, extremely important, these medications. As a cardiologist, invariably we also come across these patients with hyperuricemia, and we have to deal with them. So with this, I've been told that we also have Professor Zahra Nazish. Is she there, ma'am?
Assalamu alaikum.
Ji, walaikum salam. We can hear you now. Great to have you.
I appreciate both the teams. I joined late. I could not.
Hamza, since I can't hear, I would like to take your permission to leave.
Sir, it's great to have you. It was great to have you.
Right?
Please, ma'am, go on. Please go on. Please, ma'am.
I appreciate both the teams. Both teams were very well prepared, and I especially congratulate the Muzaffarabad team for winning the match.
Thank you very much. It was great to have you on the show, ma'am. We look forward to having you in the subsequent matches also. So again, I think your team, they really started off well. But in the end, one team wins and the other loses. So it's never a loss, it's victory for everyone, and especially mentors and teachers like you. So we have Professor Kashif Ali Hashmi Saab. Sir, are you there?
Yes. Very exciting match. Both teams performed very well, and I congratulate Muzaffarabad team for winning this contest, and very informative session as well. And I think because of internet issues in different areas, might be because of that there is some transmission issues.
Thank you very much, sir. I think you're very right, very rightly put up. And now that we have come to the end, I will request Professor Javed Akram Saab to give his final comments so that we can close the session and this match. What a wonderful match it was. Sir, are you there?
Yes. Thank you so much, Hamza. As always, it's a pleasure to listen to you, to see you, and the way you conduct it is unmatched. And may Allah bless you with more and more. You are an asset to us, not just for this Premier League, but otherwise, mashallah, you are a great physician and a great orator. And we really enjoy your conduction of this. I think 90% interest is, for me, is always listening to you personally, and always, it's just, the way you conduct is unmatched. And both teams, I think, from my point of view, are the winners, because the contest was so good, and mostly the questions were very well framed, and they were very good questions. Obviously, these things are difficult, and medicine is an ocean, I always say, and we all of us, including myself, we only know about a drop of it. So there is so much to explore, so much to know about it, and these matches just motivate us and the participants, our children, to learn more, to do more, and because after all, we are all dealing with life and death. Our business is saving lives, so we have to, improve ourselves as much as we can, so we can save more lives. And we all know our religion says that if you save one life, you save the entire universe. So thank you so much to everybody, Nazish, Kashif, Aziz Saab, and of course Ishaq has left. But it was a wonderful opportunity to be part of it. Thank you so much.
Thank you very much, sir. I think such great comments, and I'm extremely humbled because we have all looked up to you as mentors. You've been a mentor to so many of us and to the upcoming generation. And it was a wonderful game that we have had today amidst such a strong galaxy of stars, our faculty members, our council members. And I once again congratulate both the teams for putting up this beautiful performance. Again, this is a tough task. We all know, coming up in front of this audience and then performing so well. So well done, Nishtar Orions. Great performance to you. Very well done. 𝐏𝐚𝐬𝐬, Invincibles. It was brilliant. So congratulations to all of you. And with this, we come to the end of this second match of this first season of Cardiometabolic Premier League. And it's now time to head back. And we'll be looking forward to the next game as always. So till then, Allah Hafiz from my side.